I'm Vanessa Mashania in Jackson, Mississippi, and behind me, the pink building, was the site of the abortion clinic Jackson Women's Health Organization. It's the Jackson in the Dobbs v. Jackson Supreme Court decision. And I'm here because a recent study suggests that states that have passed near or total abortion bans have significantly higher maternal death rates. Now, the pro-life side, they say those numbers don't tell the entirety of the picture here, but regardless of beliefs, there are people here and throughout the country who are trying to turn those statistics around. Let's first dive into these numbers. Overall, the Commonwealth Fund, a nonprofit that funds independent research on healthcare, shows that the United States in general has the highest maternal death rate among high-income nations at 24 per 100,000 births. For Black women, that statistic more than doubles to 55.3. Zooming in on America alone, the Commonwealth Fund says that in data from 2020, maternal death rates in states that had restricted abortion had a 62% higher maternal death rate than states that currently have no bans. The study says these numbers highlight the lack of maternal health infrastructure, having a 32% lower ratio of OBGYNs to births and a 59% lower ratio of midwives to births. Both sides of the abortion issue see these results differently.
A lack of abortion access often correlates with a lack of healthcare access.
Vera Lyons with the Mississippi ACLU says these numbers show that when certain states banned abortions, facilities closed, and some of them were providing other women's health care as well, leaving states with fewer options than they already had. Areas where this happened, she says, were not well equipped to handle the health needs of women and mothers, like when ectopic pregnancies happen or when the fetus dies in the womb.
There are a lot of women who are going to be forced to carry pregnancies to term for non-viable fetuses.
While the ACLU plans to lobby against further bans in the state, they believe one solution would be the expansion of Medicaid in these states to cover mothers after birth.
Medicaid only goes up to 2 months after pregnancy, but the CDC has found that, what they count as maternal mortalities occur within that 43 to 365 day window postpartum.
National Right to Life, a national anti-abortion organization, says this study uses numbers from 2016 to 2020 and, quote, the conclusions drawn have nothing to do with abortion laws that may exist now since all states were governed by Roe v. Wade at the time. In a statement to us, the group points out that there are several bills proposed by Republicans at the federal level that, if passed, would provide things like portals to link women up to federal and state aid, expand the child tax credit, and would, quote, permit pregnant mothers to receive a monthly payment starting several months prior to a child's due date.
It's a reflection of the kind of health segregation that we have.
Another recent scientific study suggests a solution needs to happen at the research level. Jacka Steinberg is an obstetrician at Northwestern University Feinberg School of Medicine. She conducted a study that shows that all non-white racial and ethnic groups are underrepresented in OBGYN clinical trials, which can have harmful impacts on maternal health.
Research outcomes only capture what health looks like in a small fragment of the population. And our ability to address health inequities is hugely limited.
Those who debate this issue do agree that more needs to be done to help mothers and mothers of color beat the odds. Vanessa Mashania, Scripps News, Jackson, Mississippi.
Student leaders say their worst fears about student mental health are coming true. The one thing that teachers and administrators say could help. Next on The Race.